Welcome back. I'm Dr. Rohrich. I'm a plastic surgeon in Dallas, Texas. Let's talk about high definition body contouring. And let's talk to the source, the innovator, the one and only Dr. Alfredo Hoyos from Colombia. He's taught thousands of us on how to do body contouring, but high definition to the highest level. So, Alfredo, welcome. Thanks for joining us on this amazing podcast.
No, thank you very much for inviting me. I feel very honored to be here with you guys.
Well, it's my honor. So Alfredo really has defined and really high definition body contouring, and he's taken everything to the next level. So today you're doing high definition body contouring, but you're also doing fat augmentation with it, both in males and females. So tell us, walk us through on why and how you do that, and of course the safety associated with that.
So it's an interesting journey because we started to do fat grafting inside the muscles, specifically around 2008. So it has been a very long time. It's a very long journey. We started specifically with deltoids and pecs because those are the two muscles that actually enhance more the V shape in men. And we later started to do biceps, triceps, and slowly going in another types of muscles. And later 2015 happened. And mainly it was forbidden to do fat grafting inside the muscles. Specifically the gluteus major muscle. And we know that the biophysics, the biomechanics of the muscle actually prevent us to have a reliable result in a way that we can keep it safe in the gluteus major. So it actually went backlash for us, in sense of every region.
Right.
So one of my literally my personal journey there was going back again, step by step. I went back to square one, to prove that every single muscle that we did fat grafting on was safe,
Right.
And ever since then, we actually did a large, like 3 article section that were like literally sister articles about different regions, specifically the lower limb, upper limb, the back. We already had the background of the grafting, the rectus abdominis muscles by a Brazilian surgeon, and the enhancement that we already had in the pecs. So with that in mind, we already had some of the pieces of the puzzle getting together.
Yep.
But it has been a long journey in the sense that proving that each muscle, according to the configuration, according to the vascularization, according to the the biomechanics of the muscle, is reliable and safe. It has been a long journey, and there are some other muscles right now that I consider safe, but there are others that I consider not safe. Besides the gluteus maximus, for instance. So we are right now, it's a group that we actually designed with several surgeons, specifically with Dr. Stefanelli, that he's also not only a brilliant plastic surgeon, but also an anatomist.
Right.
And Dr. Prato from Brazil that actually are joining forces with the ultrasonic guidance as well. And designing a way to do a classification of the muscles. It's a new article that we're going to release soon. And it's a classification from 1 to 5. Right. Based on the anatomy of the muscle, the vascularization of the muscle,
right.
the biomechanics of the muscle, and how easy it is to graft with or without ultrasound. So we added the ultrasound into the equation.
For safety. Right?
And
for
with
safety.
this, for safety, yeah. So with that in mind, we actually had some surprises. There are some, specifically the muscles that are below the hips, so usually the lower limb, the legs and the calves, they have a specific, like, anatomical difference with the upper body, because they have an additional layer of muscular fascia, so it's a fascia that is covering the whole region and has a pump mechanism for doing the venous flow back,
Right.
So they have to literally win the gravity, and get the flow of the venous flow up, back to the heart. So actually it's so much that physiologically it's called the second heart, And with that in mind, anything that is close to these veins can be potentially very dangerous.
Right.
So the trajectory of the femoral artery and vein specifically. So is the adductors in the vastus medialis. are the regions that we actually consider not safe in terms of the trajectory and the anatomy, you know? And another ones are the safety actually gets increased or decreased according to the ultrasonic guidance and how skilled the surgeon is in doing ultrasonic guidance. So for instance, the rectus abdominis, the internal obliques, the external obliques are muscles that require more training for the surgeon, more skills for the surgeon, and a better resolution ultrasound than the regular ultrasound that you can find in Amazon, for instance. You know, so we need the special, you know, special skills and special devices. You know, so with that in mind, we actually get into this classification.
That's great. I mean, it's great, and it's actually, I saw your presentation, and it basically it's like the muscle classification from Ford and I and Mathis. It's phenomenal. So okay, so that's fantastic. You've done the work, you've done the safety. So what about for that, you know, high definition body contouring surgery, somebody you trained? What are the safe areas to do first? Is it the pec and the deltoid, and it's the volume, right? Those are the things you shouldn't, you know, don't do crazy stuff. So start in the safe areas. And that's really is it more in males than in females? Obviously for bodybuilders, is that correct? Just for the viewer.
Exactly.
So they're saying, okay, we're taking fat out, we're redefining it, now we're putting fat in. Now that is for, a lot of it's for body contouring for males, right? In the pecs. And these are safe areas, right? And tell us a little bit more about that and the volume you should use.
So there are muscles that we actually don't need the ultrasound all the time. We actually do this third stage. You know, the first stage is that you have to do mapping. So you need to clarify the anatomy, especially the vascular anatomy, and pinpoint it. Right. The second one is what we call A to Z. So we need to actually go from the moment you put the cannula in to the moment it goes out. And the third one is verification. The easiest muscles are the ones that we only need verification. So in those ones are the latissimus dorsi, the biceps, the long head of the triceps, the deltoid, and the pecs. You know, we can add a little bit of the trapezius if we want. You know, the idea is that the trapezius has a little bit tricky in the axis because the axis has to cross a fascia that is very hard. So mechanically for the surgeon can be a little bit more challenging. But you know, these muscles are the muscles that you don't even need an ultrasound if you wish to not to have it. You know.
Okay, and that's mainly done in males, right, or in body contouring, or in bodybuilding folks. Is that right?
No, we do it mostly in male. Yes, so specifically in male, what we want is to enhance the upper torso. Right. In women, what we want is to enhance maybe a little bit of the arm. So we do a little bit of the deltoid, but we actually do more legs and calves, for instance. You know, in women they want to have more gluteal area, legs and calves. That's the main conception of augmentation is there, you know? Yep. And you see it in the gym, you know, when you see a woman working in the gym, they're working the legs and the butt, you know? If you see a man in the gym, leg day is not a good day, you know? So in essence, that's what we want to achieve, you know, to gain this augmentation in the areas that actually make the patient to look more athletic, you know?
Okay, that makes good sense. So for the viewers, how do you find a surgeon that has this level of expertise? I mean, obviously, you know, many of them come to Columbia, but how do they find somebody? Because this is highly sophisticated, and also it can be fraught with problems if you don't know what you're doing, especially if you're not doing it with ultrasound, right?
Exactly. Yeah, unfortunately, I think these require specific training. I think in Total Definer, we're committed to do a very, very intense training for the surgeons in order to make it safe and make it reliable. You know, so I think one of the main sources that you can have is a surgeon that was trained by Total Definer. You go to totaldefiner.com, you can see a map, a world map, and you can choose your country, and you can even see what doctors have been trained by us. You know, I think that's the most reliable source. You know, there are some other specific courses that actually do training in that. But, you know, I can only recommend what I see, you know, so. Right,
and that is a very, very rigid educational program that's been proven to work. You know, I agree, and we'll definitely, we'll post that as well. So final thoughts on the next steps. Obviously, so you've established the safety, you've established the areas of the go, no go, and so what's next? What's next in high definition body contouring? So you've added fat, you've done high definition sculpting.
Yeah, I think one of the keys that we want to master right now is the skin retraction. You know, the skin retraction is still a problem for us,
Right.
especially in high definition. You know, actually can make that the patient cannot have the level of definition that they wish,
Right.
because the skin is going to wrinkle, or you know, they're not going to have the desired results in the long run. So that is a piece of the puzzle that we're still getting into. I think the second is, you know, we need to refine a little bit the types of muscles that we are going to do fat grafting versus the one that we need only to do liposuction. I think the refinement is they can take a little bit more these muscles and the proper way, the proper access to do it. Because right nowadays, what you go to a congress and, no, I do it this way. And the other say, no, I do it this other way, you know. I think it should be a more reliable way, a more scientific way than just, it's my taste to do so.
Right. No, I agree. Hey, you also have a new book that you published on contouring, and so how do you get a copy of your book? It's obviously self-published. How do they get it on Amazon?
So yeah, so it's a book that we call the Rib Revolution book. It's actually about what we call the next frontier in body contouring, that is the bony structure.
Right.
So it's a book that we did the self-publishing. You can find it on Amazon, or you can actually do it through the TotalDefiner.com app, you know, our app or our website.
Yeah.
So you can find it there, and we're gonna do a wide distribution in the U.S. soon.
Yep. No, it's an amazing book, and by an amazing surgeon. So Alfredo, thanks again for your time, your expertise, and your amazing giving back to teaching such a high level of body contouring. It's phenomenal, and his meeting is really kind of an assortment of amazing, innovative talent that comes together once every year. So where is next year's meeting?
Next year's meeting, I have a surprise for you guys. You know, it's going to be in Miami.
Oh,
we're going to do May 16 and 17
awesome.
of May.
You heard it here. Really, that's awesome.
Yeah.
Well, we'll have to have you back and give us a preview of that. So, well, that'll be great. That'll be great. So, as usual, Alfredo, it's so great to see you, and thank you for taking time out from your practice and your family to join us today, and obviously helping all of us become more educated and a better understanding of what is true excellence in plastic surgery and body contouring surgery. So, until next time, give us your thoughts, give us your comments, and stay tuned.